Good afternoon, everybody. Hope you're having a great day. Dr. Kevin Lewis here, your Greenville injury and wellness expert. Hope you're having an awesome day today. So this week, the question was brought by one of my patients, and she asked, what kind of doctors are chiropractors? So I thought that'd make an excellent topic today for our Facebook Live, as that's a question that some people ask, and it's a very valid question to ask. Are chiropractors medical doctors? Are they real doctors? What kind of doctor are they? So yes, chiropractors are doctors. They are not medical doctors. They're not doctors of osteopathy. They are doctors of chiropractic, earning the chiropractic degree or the doctorate of chiropractic degree, and which allows them to examine, treat patients. So chiropractors are primary spinal care doctors. They're portals of entry into insurance, so they're a primary physician, meaning you don't have to get referred to them like you would for some specialists. You can walk right in, and usually, the insurance coverage will kick in. And doctors of chiropractic have the ability to examine, diagnose, and treat patients for neuromusculoskeletal conditions, so conditions of nerves, muscles, and bones. And the training that doctors of chiropractic receive, they receive 4,800, and let me look at my notes, 826 hours of training in chiropractic school. Medical physicians receive 4,667 hours. So chiropractic school is anywhere from 200 to 800 hours longer than med school, and that's because the residency portion is essentially wrapped into the chiropractic school portion. Where the training differs is medical physicians are trained a little bit more as generalists and spend a lot of time in pharmacology and some surgical procedures. Whereas obviously chiropractors, since we don't prescribe drugs and we don't perform surgeries in most cases, don't spend a lot of time, we spend some, but don't spend a lot of time in pharmacology or in surgical procedures. But we spend about 3 times the amount in training for anatomy, training in anatomy. Well, that's obvious that we would need to do that because we're a very anatomically based science. Looking at the anatomical structures of the spine and or extremities, determining and diagnosing problems with those, and then correcting that through adjustments or other therapies. So it makes sense that chiropractors spend a lot of time hands-on with anatomy and physiology training, how the body functions, moves, and what it's made of. So doctors of chiropractic can perform their own exams, don't need a referral. They can write their own treatment plans and determine the proper treatment, and then they can also determine the outcomes, the effective outcomes of that treatment. So I hope that helps answer some of those questions of what kind of doctor a chiropractor is. So the proper term is doctor, and they are primary care physicians, especially for neuromusculoskeletal conditions. And they are portals of entry into the insurance realm, and they're accepted as such. Now, some chiropractors, like medical physicians, receive specialized training to specialize in areas. For example, I specialize both in nutrition and then injury care. So nutrition helps me with wellness, and then my specialization in injury care helps me treat both sports and other types of injuries like car wrecks, slips and falls, things like that, where there may be some injury that's occurred. And I'm trained as an expert to not only treat those and examine those and diagnose, but then also testify as an expert witness in those cases if need be. And so chiropractors can receive specialized training to help them, focus on the things that interest them and help get the results that they want in their practice. So I hope that answers your questions of what kind of doctor a chiropractor is. I'm going to provide a link in the comment section below of the different types of training. We work well with your medical physicians. Matter of fact, my number one source of patients in my office, people come to me, is referrals from their primary care physicians or their specialists. We work well with that. The days of medicine and chiropractors tending to fight each other seem to be, for the most part, in the past, and we tend to work very well together in an integrated approach to help you, the patient, get the results that you want. We call that here, your life effect. What are your goals? What is it that you're trying to achieve? And we work with anybody that we need to make sure that we get those goals. So if you guys have a great week. I hope that helps you understand a little bit more about who chiropractors are and what they do. Next week, we'll talk a little bit more about that. Hope you have a great week here. If you have any comments or questions, just post them in the comments below. I'll be more than happy to answer those. And we'll see you here next week. Have a great weekend.